Welcome back. We are talking about your health right now. Lung cancer is the #1 cause of cancer deaths worldwide, and mostly it's because it's often diagnosed in advanced stages. And we know when it comes to any cancer, early detection is key. So we have Dr. Robert Gilbert, a radiation oncologist at the Mitchell Cancer Institute, here to talk more about how important it is to make sure you're getting those screenings and also the treatment options that are available. Thank you for being here.
Well, thank you for having me.
So just moments ago, as we were in the commercial break here, we were talking about the importance of screening. So who are we talking to here? Is there someone missing out?
Right. So I think a lot of people don't think about it, and a lot of times we think that, well, it's going to be at an advanced stage, so we shouldn't look. But we actually do need to find it early, and preferably stage 1 or 2. So the group that we worry about the most are heavy smokers, and that's defined as people who have smoked about a pack a day for 30 years or the equivalent of, who are between the ages of 55 and 80, and who either are still smoking or quit within the last 15 years. People think, well, I quit. My doctor told me at 10 years it's okay, and really up to 15 years we need to keep screening.
Would people who don't smoke also need to be screened?
It's not been shown to have a survival advantage, so it's not finding enough of them in those patients. There's always somebody who never smoked, never was around it and got it, but it's harder, and we'll probably do more harm than good to try to screen those people. So we're just wanting to target the people that we are really sure are at high risk.
So if you are a smoker and maybe if you have a cough that just won't go away,
I certainly think that would be somebody that I would want to get looked at, and probably I would check them just for the cough, and it wouldn't even really be a screening. We'd be looking at what's going on for their cough and likely find something.
Okay, so what is involved in a screening? Is it something that people need to be concerned about, or is it pretty simple?
It's pretty straightforward. It's a low-dose CT scan. A lot of people get scared about going in and having a scan of any kind, but it's a very low radiation dose, and it actually does a great job at screening the lungs because they're mostly air, so it's easy to do that with a lower dose.
And in terms of treatment, because I know that there are so many options available, and that depends on what stage you're in.
Absolutely, and again, what we're hoping to do is catch these people early, so I'd like to spend more of that time on stage 1 and stage 2s. So there's a couple of options. If somebody's a perfectly good surgical candidate, we still usually do offer them surgery first, and that's usually a lobectomy. That has the highest cure rates. The radiation that I do is a pretty close second, and it's really good for patients that are either inoperable, meaning that their other medical conditions make them unable to go under anesthesia, or it's unsafe, or people who just say, I'm not going to have a surgery no matter what, I'd just rather let it go. We actually offer a really good option that sometimes the control rates are up in the 70s to 80s, and in rare cases 90% range.
Well, this is Lung Cancer Awareness Month, so what better time to get that screening?
Absolutely.
All right. Well, thank you so much for stopping by. And we're going to have this interview posted on our YouTube page, so look for it shortly.